Hi, this is Healing Talks with Kingdom Docs.
Hi, I'm Dr. Hussein Musa,
I'm Dr. Adatone Musa.
and we're just really happy to be here today. My wife, she still is with me, and she says that I'm a wonderful husband, a doting father, an amazing physician. And whether she said this or if I imagined it, that's not really important. But the truth of the matter is that we're here today to talk about healing.
Well, if I don't have anything nice, I'm not going to say anything at all. That's what my mom used to tell me.
Anyway, we're talking about different perspectives on healthcare, and we always want to empower patients with information to help them make healthy choices and how to advocate for themselves. And we live in a society where information is everywhere.
Yeah.
And what's really interesting now is when you go to the doctor's office, you're already armed with your own differential diagnosis, what we call like your top three likely candidates as to why you're ill or what's going on. You've already did the Google report on the side effects of medications that could possibly treat you. Some patients even come in already knowing what they believe they have and what treatments they should receive before ever seeing a doctor or having even a single test.
Right. Yeah. There's so much information at your fingertips with the internet, and I would go even further to say it's not just the biology and science and the diagnosis that a patient is looking at, but they want to know who the doctor is. They'll look up who that doctor is,
Yes.
where they went to school, what their favorite color is, everything.
It's very true. I'm always surprised when patients can tell me a good portion of my life history before meeting me. And that just lets you know that as a physician, people are very interested in who you are, and they care about that because you have control over how you're going to treat their health. And the relationship between a doctor and a patient is critical. And it seems that now with so much information, it almost feels as if that doctor-patient relationship can be established before you even meet your doctor, which can be very concerning.
It can be concerning, but it can also be something to your advantage as a doctor or a healthcare provider. I think with the advent of the internet and then just this rapid evolution of social media, it's important to establish your presence on the internet. This is where people live. They're on YouTube, they're on Facebook, they're on Instagram, etc. And this is another way that patients establish trust with their physician.
Yes, and we always go back to that doctor-patient relationship, that trust, so you can establish a therapeutic relationship, because we know that we listen to people that we trust. If you don't trust your physician or healthcare provider, you're not likely going to follow their plan. And if you don't follow their plan, oftentimes it can lead to you not receiving the healing or the relief from your illness.
Yes, absolutely. So trust is a big thing. How do we establish this trust in such a tech-savvy population?
Well, since all of your information is already out there,
Yeah.
as a physician and even as a patient, you should really monitor what's out there.
Yeah.
And as a physician, you have a lot of control over what your patients can see. So give them information that is beneficial. Give them information that will make them feel comfortable before they even walk into your office. And when they already have looked at your website, looked at your social media presence, looked at the philanthropic endeavors, look at how you go on mission trips, look at how wonderful a person you are before they even go into the doctor's office, you're already ahead in terms of establishing a great relationship with your patient.
So really, I think cultivating a digital environment that is encouraging, that's healing, that's positive, so that really the patients, when they're doing their research, they can focus on the positive rather than the negative, correct?
Absolutely. Well, that's all the time we have for today. Please visit us at kingdomdocs.com.
Bye-bye.